All right, so we are down to today's episode of muscle anatomy questions. So number 2 question: a 45-year-old carpenter complains of pain on the lateral side of his right elbow. The pain worsens when he shakes his hands or twists a screwdriver. The doctor presses a specific bony bump and asks the patient to extend his middle finger against resistance, which produces a sharp pain. Which muscle is most likely inflamed? So we have the flexor carpi radialis, extensor carpi radialis brevis, pronator teres, and we have the brachioradialis. All right, now the question is quite simple, really, but then it's quite trickish. Now, looking at pain in the lateral side of the right elbow. Now, the elbow joint has two epicondyles. We have the lateral epicondyle and we have the medial epicondyle. The extensor of the forearm originates from the lateral epicondyle, while the flexors originate from the medial epicondyle. So the muscle we are looking at here is going to be most likely an extensor muscle, right? But we are looking at what connects the elbow to the middle finger, because by the time the middle finger was extended against resistance, it produces a sharp pain at the inflammated area. Good. So, is it a flexor carpi radialis? A flexor muscle originates from the medial epicondyle, so it can't be a flexor muscle. So, a flexor is out of it, right? Because the flexor muscles actually it inserts into the second and some parts of the second metacarpal and some part of the third metacarpal too. The pronator teres is actually originating from the medial epicondyle too. It's actually used in twisting of the arm, right? Twisting of the arm. Okay, so yeah, the question says that the pain worsens when he shakes his hand or twists a screwdriver. Yeah, even though it is used for twisting of the arm, the pain is supposed to be on the medial side, but now it is on the lateral side, so it's not the answer. So pronator teres is out of it. All right, and pronator teres actually insert into the lateral surface of the lateral surface of the radius, right? Yeah, the middle of the lateral surface of the radius. That is where the pronator teres inserts into. And then we are left with two options here: the brachioradialis and the extensor carpi radialis brevis. That is your ECRB. Okay, so the brachioradialis actually originates from the lateral. However, it is up the lateral supracondylar ridge, and the function is actually to bending of the elbow. Now, the question says that the doctor presses a specific bony bump and asks the patient to extend his middle finger against resistance. Now, the extensor carpi radialis brevis is what connects the elbow to the middle finger. That's the reason why when they did a monthly test, it's a monthly test, all right, because when you grip something, the muscle is being contracted or it's being strained, all right. That's the reason why when he was shaking his hand or twisting the screwdriver, he's feeling that pain on the lateral side, okay, because it is the extensor carpi radialis muscle. And how did the doctor want to know if it is truly the extensor carpi radialis muscle? He asked him to extend his middle finger because that is where it is inserting into. All right, so the answer here is the extensor carpi radialis brevis, which is your ECRB. And the kind of symptom we are looking at here is your tennis elbow. For flexor carpi radialis and pronator teres, is going to be a golfer elbow, all right, and it's seen at the medial part of the forearm. But for extensor carpi radialis, it is the tennis elbow, right? So this is an example of the tennis elbow. You can see the extensor muscles originating from the lateral aspects, okay, and it's going to insert into the middle finger, right? Yeah, so that's it.